I'm very proud to say that we're delivering the best primary care pediatrics in the city, in the state, one of the best in the country. Our families here in the Brooklyn area have to travel a lot less further than they had to before for those services, and we all work together to deliver the best possible care.
Hi, welcome. My name is Rory O'Malley. I am so excited to be your host this evening. You may have seen me on stage in some Broadway shows like The Book of Mormon or Hamilton, or on screen in movies like Dreamgirls, or the small screen recently in Modern Family. I am here with my adorable, amazing, wonderful husband. Hello, Gerald Schroeder. We're overjoyed to be participating in this exciting health and wellness series, Center Stage with Healthcare Heroes, presented by our friends at Playbill and the Weill Cornell Medicine. Tonight, we'll be discussing pediatric care and precautions during COVID and how to keep your children safe, which is very important to us because we are parents. We have a 2.5-year-old, and that's all we think about is how do we keep this little kid safe, especially this year. We're going to be joined by 3 wonderful physicians from Weill Cornell Medicine. They are Dr. Karen Acker, Dr. Sherry Wong, and Dr. Ben King. Hi, doctors. How are you?
Good.
Good.
We are so glad that you are here because we know nothing about this. People were asking, are we going to be the ones answering these questions? Thank God, no. We have professionals. We're so happy to have you here, and thank you so much for taking the time to answer these questions. We're going to be asking the doctors some questions that we think that will be on your minds, but please feel free to write into the chat any of your questions that we haven't covered. Let us know what's on your mind and what your concerns are, and we'll relay that to the physicians. So my husband Gerald will get started in a moment, but let's introduce the doctors first. Why don't we start with Dr. Karen Acker? Can you tell us a little bit about your background and what you do?
Yes, of course. Hi, everyone. Thank you so much for having me. So I am a pediatric infectious disease physician at Weill Cornell. I've been there for the last few years. But I did all my training in New York. I was at SUNY Downstate in Brooklyn for medical school, at Cornell for residency for pediatrics. And then I did my infectious diseases fellowship at Columbia. And in the last year and a half, I assumed the position of the hospital epidemiologist for pediatrics. And what was funny about that is that I became in that position. I went on maternity leave a few months later, and then I came back to a pandemic. So it was a really great training, learning, and kind of as I was starting on my epidemiology role. And given everything we've gone through, though I've learned so much, and I really hope I can help answer your questions and also provide reassurance in the pediatric community, because we are very fortunate in pediatrics that kids have fared quite well.
Well, thank you so much for being here. Dr. Wong, can you tell us a little bit about yourself?
Sure. So I'm Sherry Wong. I'm from Brooklyn, New York.
Nice.
I went to do my schooling in New York also. So I attended medical school at NYU, and I stayed and completed my pediatric residency there. So I'm a general pediatrician. And I joined Weill Cornell about 6 months ago as the site medical director in their Lower Manhattan site. And before this, I was at a community health center, the Charles B. Wong Community Health Center in Chinatown. And I was there for 13 years. I worked a lot with children with special needs, so I have a special interest in that. So I really worry about them during this pandemic.
Fantastic. Well, thank you for being here. And lastly, Dr. King.
Hey, hello, Gerald and Rory. Thank you so much for doing this. I'm really happy to be here. So I'm Ben King. I'm also a primary care pediatrician with Weill Cornell. I was born in New York, but spent most of my life in Florida, and my schooling for undergrad and medical school was at the University of Florida. Go Gators, you can kind of see it above my head. And I moved to New York City for residency at Columbia in Upper Manhattan, and I am currently a primary care pediatrician with Weill Cornell, and I work in our Brooklyn Heights clinic. It's our one sole clinic here in Brooklyn, and yeah, come see us.
Fantastic. Well, let's dive into some of these great questions that we have for all of you.
Okay, the first question is, what percentage of children get serious COVID symptoms compared to adults?
So it's a great question. And actually, it's not as simple as you would think it is. Well, one is that it's difficult to determine what we call the true incidence of infection in general in kids. And that just means how many are becoming testing positive for COVID. One, many are not tested. So many children we've seen don't develop symptoms or develop mild disease, so they're often not tested. Parents don't want to bring them in for testing. And that was certainly the case early in the pandemic. So our rates at that time of just children testing positive were initially about 1% of the population. Since then, and I will give you numbers though, in just a second. So I know that I like also to have kind of numbers to see. Additionally, though, even though people do test positive, we often don't have that clinical information, whether they're symptomatic. Many are just getting tested before going to school or before an activity. They just have to, and the pediatrician will do it, but it's not necessarily that we're collecting, exactly what symptoms are going on. And that's a good sign. That means that not much is going on with them, probably. Additionally, in the United States, states report differently. So even the definition of child is different. In some states, they'll say 0 to 14, some will say 0 to 18, some will say maybe 0 to 21. So given that, though, thus far, fortunately, we do have the American Academy of Pediatrics along with the CDC give us numbers. So as of April 15th, 3.6 million cases of children who tested positive were reported. And that was out of about 26 million. So that gives us a rate of about 13.6% who tested positive. And if you're looking at rates per population, for 100,000 children, that would be almost 5,000 cases per 100,000 children. So that's how you kind of normalize it for the population size. And in terms of who tests positive, of all the children that get tested, so one is that children will make up about anywhere from 6 to 20% who get tested of everyone. And of those who get tested, about 5 to 33% test positive. But what's really fortunate is that of all the COVID hospitalizations we've seen in the country, only about 1 to 3% have been due to children. And of those hospitalized, and of all the children who have tested positive, it's anywhere from 0.1 to 2% who get hospitalized. And of those who are hospitalized, about a third require more intensive care. So it's like as we break it down, the numbers are overall pretty low compared to what we've seen in the adult population.
Do we know why children fare better than adults?
So we don't know exactly why. We do think that we've seen that age is probably one of the biggest risk factors for severe disease. Yeah. That the older you are, the more likely you are to get severe disease, become hospitalized, develop respiratory disease and pneumonia. But there's other factors that weigh in there. We've seen obesity as a really big risk factor, any type of blood vessel disease, so people with high blood pressure. So there's multiple kind of hypotheses that have been put out there. With COVID, it's a virus, but it causes an infection that sometimes looks like a bad bacterial infection. Lots of inflammation, really high fevers, a lot of inflammation in the lungs. A lot of the blood markers of inflammation are really high. So this tells us that the immune system is really, really active when someone has a bad infection. So there may be differences in the immune system. And we know there are differences in the immune systems between children and adults. And we think maybe those differences are a reason why. That's one. Another is the SARS-CoV-2 virus it binds to a receptor in our cells called ACE2. And that receptor may look a little different in kids. There may not be as much of it in the respiratory tract. It's not really clear. It may bind to the virus a little differently. That hypothesis hasn't really panned out, but it's a possibility. And then there's kind of multiple other hypotheses that have been put out there. Kids get a lot of other viral infections, and upper respiratory infections, and it's thought that sometimes other viruses can interfere with another virus and maybe allow for some protection. And then also just children have less underlying medical conditions. So as you can tell, we don't know for sure. Everyone is trying to look into it.
Okay. Well, and as two parents who are about to send their 2.5-year-old to preschool soon in August, what's the biggest difference between symptoms we should look for between like a cold? Jimmy hasn't gotten sick really this whole past year, so like anytime he's gonna get a sniffly
But
nose
if he gets a scratch, we're concerned with COVID. You know what I'm saying? Like that is just where we're at. Honestly.
Yeah. Oh, Ben, you're.
Don't mute yourself. Number one rule of the webinar. I was saying, like, this is my joke. Like, he stubbed his toe, and like it was definitely COVID, right?
Yeah.
Exactly.
Yeah. I mean, I could start, and then I can, because you are all seeing it on the front lines, really, in the outpatient. We can't differentiate. That's the thing, is that it's not, in kids especially, the symptoms are pretty similar to other respiratory infections: fever, runny nose, cough. They could have vomiting or diarrhea. I see that kids, no matter what illness they have, they vomit. I feel like that's one of the main things. It's like it could be anything. They vomit. So you can't tell. It's not while adults, the loss of their sense of smell and taste is quite specific for COVID. We're not seeing that in kids that often. Although certainly when my 3-year-old one day said he couldn't smell, he likes to pick up the diaper of my 1-year-old, the clean one, and smell it. He's like, I can't smell it. And I was like, what? I don't think that's an actual, that we're actually seeing that. So you can tell. So it really depends on what our community rates are to determine how often or when you should get tested, when your child should get tested.
Okay.
So I agree with Dr. Acker. And that's such a great question. That it's something that parents, caretakers, teachers, and clinicians, we all struggle with. How do we know when, little Bobby or Sophia can return to daycare or should be kept home from school, should participate even in that sports team, right? And I agree. The bottom line really is we can't tell without a test. Symptoms of like COVID overlap with a lot of symptoms of common conditions that we see in the office. And that includes like common cold, flu, strep, stomach viruses, seasonal allergies, pneumonia, and even want to throw that in there, vaping related lung injuries. So I think it's really important to have a high suspicion for COVID and to test, but also keep an open mind that many children may have other common illnesses.
Okay.
Yeah, and I agree too. I think that most viral infections have a lot more in common than they have apart. And usually we say that, like, I'll test for things that I can do something about. So flu is a good example. Early enough, we can potentially treat and reduce the symptoms. And we know, like, if someone in the family has flu, like, I want to know if their sibling develops symptoms and I can catch it early. So that's important. Strep throat's another example. A primary herpes infection of the mouth, like very characteristic oral lesions, like we could potentially treat and help that. But by and large, your son is gonna get fevers, runny nose, cough. Like, it's gonna happen.
Right.
And by and large, we're gonna handle it extremely well. A couple days of symptoms and then it resolves, and we're okay with that. We want to know if it's something that that's actionable. And for the most part, it's not. And the body does a really great job of taking care of these viral infections. And in kids, that also includes COVID. By and large, they're doing okay with it.
Wow. Well, it's not available to them yet, but can we talk about vaccination? Because it's going to be a big topic this year. Will the vaccines be safe? Can we talk about vaccine safety and the importance of getting kids vaccinated? Right now, it's like 16 and up or 18 and up, depending on the vaccine. But can you speak to vaccine safety?
Yeah. And I'll just start, but feel free anyone else to weigh in. I mean, so, generally when it comes to vaccines, what we understand about them is that they are very safe. But there's always a lot of hesitancy when there's an intervention, I think, that involves, an injection. But all in all, vaccines in general are very safe, and kids are extremely adaptable. The vaccines have been created, I have to say, are going to change the technology of vaccines in general. They're probably some of the most effective vaccines we've seen, and in the clinical trials were shown to be extremely safe. But whenever you're doing something to the entire population all at once, you're going to see things because things are happening to people all the time anyway. The only thing that we say to think about beforehand is allergic reactions, because anyone can have, it's an immune system response, so you could respond. And the main ingredient in the Pfizer and Moderna vaccines that is thought maybe can elicit an allergic reaction is something called polyethylene glycol, which is actually what's contained in Miralax and many, many other products. So if you have kids with constipation and you have to give Miralax, like I know my 3-year-old has been on daily for a long time, you'll know that they'll be able to tolerate it. But if that's an issue, then where there's a concern for an allergy, you can talk to your allergist and they will be able to guide you accordingly. I really don't have any reason to think why these vaccines wouldn't be safe for kids, since given what we've seen in adults thus far. And I definitely think that, and what we're seeing in terms of efficacy and how they're working, the most recent data that came out of Pfizer from the 12 to 15-year-olds showed actually 100% efficacy. No one who received vaccine actually got COVID. So when they're starting to work on the younger, to look at the younger children as well. So I will certainly, my kid, 1 and 3-year-old will be first in line. I really have, when I think about how we have risk and everything, and I take risk by putting them in a car, I take risk by, doing so many things with them. And I don't, I sometimes make myself anxious by those little things, but vaccines are not going to do that for me.
Yeah. Dr. Wong?
Yeah, I would just definitely add that we are anxiously awaiting the approval of the vaccines for children, for now 12 to 15, and then maybe later younger than that, starting in 6 months. Also want to add a little bit about protection of younger children. So unborn children and breastfed infants, they may benefit from protective antibodies if the mother gets the vaccine. So I know this is a hot topic. There are a lot of questions about that. And although there's limited data and studies are still ongoing, we are thus far not aware of any actual or potential risks of the vaccines to pregnant and lactating women. And that's one way to get some protection for the younger kids.
And Dr. King, do you have anything to add?
Yeah, I don't disagree with the two doctors before me, but I would like to say I love that Dr. Acker mentioned like the risk. I hope to touch on this when we talk about school and physical activity. Like there's no such thing as no risk for anything. Like I tell all my patients, I want you running, in sports, dancing, and guess what? You're gonna have injuries when you do things. So like there's no risk in anything. There's no zero-sum games, and that includes COVID. So it's all about risk mitigation as best that you can do that fits for your community, for your family, and for your values, and that includes this discussion today. And it's interesting to think about because we think about vaccines in two levels, like the person in front of me in clinic that I'm advocating that they get the vaccine today to prevent the spread of a certain disease that they may or may not ever encounter. And there's also the discussion about having vaccines for the population at large. And it's a different discussion and it means different things to the individual, but ultimately at large population, these vaccines are safe, they're really effective, and they're going to be the best way to stamp out this pandemic. And we're really lucky to be in a place and a timeline in the country that has them available. So the sooner that we get them available to more people, those lines should be filling up. I completely agree.
And I know that this is subject to change and no one really knows except for the FDA and the CDC, and it's being studied now. But is the timeline for those vaccines, is it fall for every kid or is it fall for just 12 to 15 and up and then younger kids next year?
So, I don't know exactly, but I know that vaccines, they seem to be moving much more quickly than I actually had anticipated. So we may be anticipating that many age groups by the fall.
Right.
Not because currently they've started already. They've started enrolling even down to 6 months, from what I understand. So,
and I think that a lot of, parents, maybe there's some who are hesitant, but so many of them really want their kids to have these vaccines now that they've had them. We're fully vaccinated. We want our son to be able to be vaccinated as well and have that protection. Okay, great.
That kind of leads into the next question. How has the pandemic impacted children, meaning physically, their physical activity, or less of it, and also mentally and emotionally? I think about our toddler having less interaction with children. I mean, he's getting more and more, but especially the first 6 to 8 months, it was like, we were in our home, in our bunker.
He's really sick of us. He's like, life is more than just these two guys.
Yeah. So yeah, just wondering your thoughts on how it's impacted children.
Sure. Maybe I'll start on this one. Thank you for telling us how it's affected you. I think maybe everyone in this chat would agree that it's affected us really strongly. It has not spared any age group. I think adults can more easily tell you, like, yeah, I've struggled, and I certainly have. I haven't met anyone that really wants the pandemic to last longer or social isolation to keep going on. Up to 2/3 of adults are reporting unwanted weight gain during the pandemic. A vast majority of adults are experiencing way more rates of kind of mental health, anxiety, depression, thoughts of self-harm. And as time has gone on, as this lockdown has gone on, or social isolation has gone on from a month to a couple months to now well into a year, we're starting to get reasonably concerning evidence of effect in the pediatric population as well. So just last month out of Philadelphia, Children's Hospital of Philadelphia, very similar setup to Weill Cornell and New York Presbyterian in New York City, like a big academic center with a lot of clinics kind of dispersed throughout the city. They asked the question, like, what were the categorically rates of obesity pre and post pandemic in their pediatric population? And they found a 2% increase pre and post pandemic. So they had 13% of their patients were categorically obese, just the medical definition, and then 15% into 10 to 12 months into the pandemic. So a reasonably high rate of increase over just 10 to 12 months. And if you extrapolate that over a couple of years, like, completely unsustainable. And notably, families, children aged 5 to 9 and or Latin, Black, or from just low-income families, disproportionately affected compared to their counterparts. And that's just weight. That's just weight for how tall you are. That's just obesity. The reasons for why that's happening are probably multifactorial. Like, some of us in pediatric medicine, we think about the obesity rates and we want to enact change. So we kind of study, like, what can we correlate? What are the factors that lead to it? We know that in the summer months, we see higher rates of jumping from normal weight to obesity weight. That's kind of been documented in the medical literature. And the reasons for that are counterintuitively, at least to me, my Florida brain, when I grew up, like, summer was, you just are outside running around all day, but there's less physical activity during the day. In the summers, there's a lot more screen time, which strongly correlates to just being sedentary, sitting there on your phone, computer, TV. And there's, like, I don't know that the nutritional content of meals is significantly different from a home to a school. I don't know that schools are doing a great job having the most healthy foods, but at least the caloric proportion of meals is preset. Like, you get, this is your lunch, this is your breakfast, go home for dinner. In the summer months, kind of just graze all day. So I kind of have likened COVID for school-age kids to be kind of like a long summer. Like, you're hanging out at home all day, you have an incredible amount of screen time, so you're not moving a lot, and then you're just eating all day. And that leads to weight gain. And weight gain in pediatrics translates to overweight in adults, and then the kind of long-term effects of that are pretty well documented. So it's definitely concerning.
Yeah, I completely agree with Dr. King that I think it's going to be a problem once we start seeing these patients back in the office. The other thing I wanted to mention was physically, a lot of, like, student athletes or children who are very active because of lockdowns or the pandemic, they're also very deconditioned at this point. And they just really need to take it slower when they get back out in the field just to avoid injury.
Right.
Yeah. And then, talking about the mental and social effects. So I agree that this year has been incredibly challenging for families and then families with children. So I think every conversation that we have, about mental health of children, we should start with discussing mental health and impact on their parents.
Yeah.
So when schools and daycares closed last year, parents overnight had to figure out childcare. For those who have to work outside the home, they had to find care or maybe reduce their hours to be able to, figure out their child's learning. And then for those parents who were fortunate to work from home, they've had to do their full-time jobs. They've had to manage their children's remote learning and then structure their free time and have 3 meals, a day on the table. So it's been incredibly stressful.
Yes.
They've had to deal with loss of income, concerns about food security, and the stress and anxiety in the parents. This directly affects children. So I would say really have to talk about that with the parents. And then routines are disrupted. So there's a lot of unstructured time and a lot of more screen time. So for school, TV, the iPad, a lot of times it's just so parents can complete their work. So really this lack of structure and routine can be difficult and anxiety provoking, I think, for children. They don't know what to expect. We're talking about remote learning also and its effects, and it's really just not as effective as in-person learning. So there are children that need physical reminders in classrooms, and they don't do so well if they have to kind of be more independent. It's harder with remote learning to track absenteeism, so children fall behind really in math or reading and they miss a certain number of days, maybe due to technological issues or family issues. And then children with developmental delays, they rely on therapies such as speech or physical therapies, and they might fall even further behind because the online modalities are just a little bit less effective. Talking about your toddler without in-person school and that social kind of emotional development of skills, they don't learn to take turns. They don't learn about sharing, conflict resolution. So maybe, sharing with you, but not with other children.
Not with us either.
No.
So teens have lost peer support, the ability to interact with role models and community members who care about them. And among the concerns that we have about teens being at home during the lockdown are LGBTQ teens who may be stuck at home and they don't have supportive caretakers. They've lost kind of their support outside of that, maybe in school or with peers. Children may be feeling really sad because they miss seeing their friends, grandparents, extended family. And then I also just want to take, a moment to get a little bit more serious and talk about the grief and the sadness experienced by children and families during the pandemic. So as you might have seen, about 40,000 children have lost a parent during the pandemic. And many more have lost grandparents, aunts, uncles, and, people they really care about. A lot of this grief has been experienced in isolation. A lot of it is still unaddressed. And on top of this, there have been a lot of traumatizing events in the country. They see via media, children see, photos or videos of violent images of police brutality, anti-Black racism, racially targeted violence, mass shootings, and these have really deep effects on children. So although the issue, prior to the pandemic, there was an issue with mental health, I think there is and will be real mental health, a real need for mental health support for parents and children and teens, and a serious need for changes to improve access.
Yeah,
Go ahead.
That's a really good point. That's a really good point. And I think that, partly I have to admit that we've been grateful that our child is 2 and that we're not having to explain everything. That I think one day I'll have to tell him all about this, and I hope he doesn't remember much about it. My heart goes out to parents who have to have the full conversation. And hopefully, as things keep getting better and hopefully they continue to get better, the new challenge for parents and for children is, how do we go back into this world safely? How do we, I mean, I have my own anxiety about going out into the world because of COVID and because of just general anxiety of the world, that now that it's like, it just seems louder, it seems busier to be doing things. So how do we have that conversation with kids? I had a friend's child who's about 8 years old. I talked to her about going back into the classroom again, and she said she was nervous. She was nervous, and she's not a nervous kid. I was really taken aback by that, and I thought, I gotta keep asking her about this and talk to her about how I'm nervous. So I guess that's probably really important for parents to have that conversation as well, right?
Yeah.
Absolutely. I think it's important to validate your children's feelings about all the events.
Right. Well, let's talk a little bit about the safety protocol and habits that should be put in place before we go back out into the world. We just had a big breakthrough today as we wear masks everywhere we go. Anytime we go outside, our son wanted nothing to do with that. He literally would grab our mask and put it on us to go outside, but he doesn't want to wear his, even though we had, 30 different masks with different colors and characters on them. Today, Gerald was able to have him keep a mask on for 10 minutes.
I had to bribe him. I bribed him with a toy, but I got him to do it.
You do what you got to do.
Right? So, there's a lot of things that we have to do to go back out into the world.
Mm-hmm.
So what are the habits that we need to do? What do we need to do to go back to school? Are summer activities okay? Beach, pools, playground? What are some of the things that we need to be thinking about as we go back into the normal world, even though it doesn't feel normal?
Yeah, that's, something I've thought about obviously a lot for the last year, because there's always what I'm supposed to be recommending at work, and then what am I doing at home? And COVID's one of the first times that there's really been no difference between my work life and home life anymore. COVID is just like made as one, but I'm not, I've never been a germaphobe, as an infectious disease doctor, that's not been who I am. But obviously we know that when we use the right protocols, we actually really can do a good job at preventing transmission of this virus. And we're fortunate that children also do not seem to play a large role in transmission. Even though with other viruses, they usually are the reservoirs. With influenza and other respiratory viruses, they really don't, they are usually, we call them petri dishes. But there have been multiple studies that have looked at different schools in Wisconsin and North Carolina, and then in Europe, there were, they looked at cases of COVID in the children in those schools, and to see where they likely got it from. And really the majority of the time, where they got it from was from home, not from school. So by putting into place, and this is in schools where they put into place, effective hand hygiene protocols, mask wearing, where kids, I know I had the same issue with my son, where I was like, how am I going to get a mask on him? And it was torture for a while, but that's because it was me trying to do it. The minute I started sending him to this gymnastics class and he just had to do it, they just do it. They're really adaptable. I'm kind of amazed with kids coming into clinic now, and I have to tell them to pull down their mask so I can examine their mouth. I'm like, it's okay, you can. So, and in terms of all the different physical settings they create in schools, distancing, how much you need exactly, it's not clear. But anything, whether it's 6 feet or if you can go as little as 3 feet, I think just creating where there's different pods, and so that you can, if there were a positive student who tested positive, you could easily kind of confine who is exposed and figure out who needs to be quarantined. So there are many types of protocols and ways you can go. We don't really know which are necessary versus not. So we're going to err on the side of being more conservative. But I think that kids can go safely back with certain protocols in place. And I'll see if Ben has any more of the specifics.
I have some specifics. I'm so glad you.
Oh, really? Okay. I was like, oh no.
Rory and Gerald, just by the way,
excellent.
your defiant toddler who's pushing the boundaries a little bit sounds right on track. So I would be proud of you. That's totally okay.
Developmentally appropriate.
That's what we want to see. Developmentally on track.
Oh.
To me, the study out of North Carolina was really important as far as like because we talked about this earlier. Like we all as families, as communities, we would just want to do what's best for our kids, and pediatricians, we're here to help. Just what's the best available information? How do we synthesize it and like help you make those decisions? So the North Carolina study, 90,000 students. 10,000 teachers, all public school, K through 12 throughout the state of North Carolina. A 3-month study of kind of infections with COVID community versus school. During a period of time, this is like last fall into the winter. So during a period of time in North Carolina where the infection rates were high, like higher than what the CDC recommends as being like a safe number. I don't know what it is off the top of my head, but high community prevalence of COVID. That would have predicted for these 90,000 students over 3 months that there should have been, if the rates of COVID infections were equal to the community, it should have been about 900 infections in the school passed between student to student. There were 32. And that's really low compared to the community prevalence. And also importantly, there were 0 cases of COVID transmitted from a student to the teacher. The lower risk student who's young, is healthy, the higher risk student who's older may or may not have comorbidities. So to me, it's pretty transformational. It's like, if you do the right things in any setting, including school, it really can be safe to prevent the transmission of an infection like COVID. So that what they stated in this paper with the 3 W's, so wear your mask, watch your distance, and wash your hands. Those are the 3 W's. And if schools do that, I think the most important thing, we're kind of getting over the ventilation piece, is mask wearing. Mask adherence is key. And if you can do that, you can do school safely. And we are learning that each day.
We have some questions here from people watching, if I can relay them to you. What do you say to parents who are hesitant in bringing their kids to in-person schooling versus virtual versus hybrid? Besides just quoting that study.
I want to say what I just said. At the beginning of the pandemic, we didn't know how to manage COVID and whether or not it would affect kids as much as it was affecting adults. We have more and more information that you can do school safely. We have more and more information that isolation and quarantine is really hard on kids for their physical health, for their mental health. And that balance is tipping towards get you back into school, talk to your family, your doctors, your community about how to make that happen in a comfortable way for your community. For your family, I'm sorry.
I agree.
Yeah.
I agree with Dr. King that, I advocate for in-person schooling, but that I just want to mention that there are kids who have thrived during remote learning. So children who have been bullied, who have like social anxiety, depression, or maybe those who are very like distracted in a large classroom, they've done really well at home. So I think you have to kind of look at how your child is doing, what was going on before the pandemic, to make that decision. But we should really learn from these methods that maybe work for these children and adapt them when schools reopen.
One thing to add also, even though we see kids are a much lower risk situation, there's definitely certain age groups that are lower than others. So adolescents and older adolescents are still, are probably of the pediatric age group, the more higher risk. So it's really fortunate that they're already starting to be able to get vaccinated. So I think that kind of handles that aspect. But for a while, it made sense that colleges were, not allowing kids to come back to campus or having more restricted protocols, as opposed to daycares. Many of the daycares that continued on throughout lockdown, really, we didn't have issues with. So.
It's also young people who can make their own decisions, but don't necessarily make the best decisions. I mean, I'm speaking of myself at that age.
I think about that. If I were in my early 20s during pandemic, Yeah, don't.
Well, and
You would have had COVID, right?
it's hard to convince those young people to,
I definitely would have caught COVID. Just saying.
Yeah,
In Florida, we're pretty hands off.
Yeah.
Right, and those are the same people that we now have to convince to get vaccinated, and they may not be scared, and but hopefully they'll be able to see the benefits, not just for themselves, but for the entire country, for the world.
Yeah.
We have another question here.
This is a good one for my parents are watching. If kids are not yet vaccinated, but adults are, is it recommended that families and loved ones can start having reunions this summer? What are recommendations for in-person family gatherings? I have a huge, 100-person family in Indiana.
Oh, yeah.
We get together for a whole weekend every summer in July. So I think those conversations are happening now.
So I think it's, it's kind of weighing the risk benefit and weighing also what your comfort level is. I find that if all the adults are vaccinated and all the children do not currently have symptoms and there's no known exposures, the risk is probably low, but it's not zero. There's still possible that someone is, infected with COVID and doesn't know it. We also don't know. We didn't really touch on, or I didn't, touch on that we are seeing new variants of this virus that we aren't entirely sure if the vaccines completely cover it. Although I suspect that they give still a decent amount of coverage, but someone could maybe be infected with COVID even if they're vaccinated but does not have symptoms. So there's always going to be a risk. So I think understanding that and going into the situations knowing that is helpful. And then you can say, all right, well, how comfortable am I with that? Do I have anyone that's at really high risk of severe infection? Are we going to be hanging out outside? Will it be nice weather, which will decrease our risk? Should we do mask wearing? I'm okay with not. I think we're getting to a point where you can make your own decisions to some extent, as opposed to before worrying about everyone was probably worrying about being judged about what they were doing with others. I think that now it's somewhat of a personal decision as well.
Yeah, I think the most concrete advice would be if you're eligible, which most Americans are, get vaccinated. That is the number one thing. And particularly 16 and up, these are the higher rates, and currently the higher rates of active infections going on in our country, 20 to 40 years old. If you're eligible, if you want to end this, if you want to see your family and do it safe without guilt, without worrying about what's going to happen, get the vaccine. Kids are probably going to do well, and then we'll figure out vaccinations in the near future for our younger population.
And also maybe if you can be hanging around, a large group of your family members, Dr. Acker mentioned mitigating risks. So spending most of your time outdoors, having the windows open, having a lot of ventilation when you're indoors. It's helpful. And deciding, are we going to wear masks when we're around each other?
Yeah.
Here's another good one from our watchers, viewers here. Do you have any recommendations about resuming physical activities like sports or dance or being in musicals? I mean, this is Playbill, right? Should parents be concerned about a greater risk of injury if kids have not been active for a while? That's an interesting one I hadn't really thought about.
I think in kids we are more worried about kids 5 to high school age. We're more worried about hyper specific activities and overuse than we are just general. Am I going to be injured from doing an activity? You can never avoid injuries. Ultimately, a graded reintroduction to physical activity is going to be the best thing. So if your kid hasn't done anything for a year, taking it slow, that's a loosely defined thing, is going to be the best recommendation. Should you be worried about risk of injury kids not being active for a while? I would be worried about them not being active for a while than the risk of injury. So let's get our kids more active sooner and let's do it safely. So we got good weather now, so we're being outside. If we're indoors with dance, with ballet, totally fine. We're probably able to be masked in those settings, have good testing and contact tracing. I have plenty of patients that have been involved with indoor physical activity, dance, theater for many months. And well mitigated through mask wearing and much like schools, mask wearing and contact tracing for testing. So it's absolutely possible. And we as pediatricians are hopefully selling that to parents and saying this is the time to reintegrate sooner rather than later, particularly if it's done safely.
I'd like to add also to not forget the sunscreen And
Oh, I don't.
Love that.
we've been indoors for a year, so like you just kind of forget, oh wait, and then we're seeing tick bites and insect bites, so don't forget that.
Yeah, I already had a tick bite in Central Park, so they're out there.
Wow.
There's no such thing as zero risk, right? So
Right.
you're gonna get that kid right back outside. So
Yeah.
All right, we have time for one more question. I'll let Rory take this one because it's something he asks every day in his own mind.
What are some things that we can assume will change for sure once quarantine has died down or is over? Will we be able to resume performances and large-scale activities indoors, like Broadway or sports? I guess I don't know.
I think. Oh,
I mean, sorry, I'll start because I won't have that much of the answer for this. But you know, our expectations kind of have to be adaptable. Given what we've seen over the last year, it seems like every time it seems to be getting better, then it gets worse again. Not saying that we anticipate that happening, but also expecting that, you know what, I think we're going to go up. We may go up and down for a little bit. I think when rates are down, we take advantage and we do activities safely. And if indoor activities we can do, if the buildings can accommodate good ventilation and mask wearing and ability for contact tracing, I think that we should try to do as much as we can when rates are low. If rates get up again, then we just have to scale back. I think we just have to be adaptable because that's what seems to really make a difference. And we're just hoping, though, that as vaccination rates increase, that we can do less of those non-pharmaceutical measures, as we call them, and rely on our medical measures to help end this pandemic.
Yeah, I was just gonna add. Yeah, I think as soon as when we get to herd immunity, a certain percentage of the population has been vaccinated or has had the virus, then I feel comfortable.
And that's what, 70 to 80%?
Oh, sorry, for herd immunity.
Oh, I'm sorry. Yeah, herd immunity. That's immunity, right?
So yeah, it infectious that variant is, but yeah, anywhere from have thought always around 70 to 80% would be enough so that we could continue. We wouldn't have a continued transmission.
Well, we just want to thank you all so much for this discussion. You know, obviously, for parents, the whole world changed, but your whole world is your kids. And we think about these questions, and as we step into a new reality over the next year, we're going to continue to have them. I'm just so blown away by the healthcare community and the doctors, the nurses, and all of the healthcare workers who have gotten us through this time. Thank you so much for all you've done, all the annoying questions that pediatricians get. Like our wonderful pediatrician, Dr.
What are you talking about?
So grateful. Oh God, I mean, I can't even imagine, how many more questions we've gotten this year. So thank you for answering our questions and everyone's questions here today. Thank you everyone for viewing this. If you want more information about the amazing services at Weill Cornell, you can go to weillcornell.org and learn more about their services and everything that they have to offer. Thank you so much to Playbill. Thank you once again to Dr. Egger, Dr. Wong, and Dr. King. You are all fantastic, and we thank you. Our little son Jimmy thanks you. We're gonna go try and put a mask on him again. Maybe not today. Maybe we'll try again tomorrow. Thank you so much.
Thank you for having us, and thank you for hosting this. It's admirable that artists in the community are as interested in helping this effort, and so it's really wonderful.
Absolutely. Well, what we do is all about the community. Our community is the audience. And if we're not well,
I'm very proud to say that we're delivering.
That was getting the old hook.
Yeah, that's true.
He's giving me that.
That's your wrap it up music right there. Yeah.
Thank you so much. You take care, everyone.
All right.
Thank you.
I'm very proud to say that we're delivering the best primary care pediatrics in the city, in the state, one of the best in the country. Our families here in the Brooklyn area have to travel a lot less further than they had to before for those services, and we all work together to deliver the best possible care.